In the journey for breathing relief amid the challenges posed by respiratory conditions, Ventolin emerges as a beacon of hope for many. This medication, a stalwart in the pharmaceutical landscape, plays a crucial role for individuals grappling with asthma and other obstructive pulmonary diseases. My aim is to shed light on Ventolin, unraveling its myriad aspects from its primary uses to the potential risks it carries. It's a journey of discovery, aiming to inform and guide those whose lives are touched by the need for such a medication. Ventolin, for those unfamiliar, is more than just a medication. It's a tool that offers a semblance of normalcy for those caught in the throes of respiratory difficulties. Its significance cannot be overstated, providing not just symptomatic relief but also the promise of better respiratory health management. As we delve deeper into understanding Ventolin, it's important to approach the subject with an open mind, recognizing the nuanced nature of pharmaceutical solutions in managing health conditions. The exploration of Ventolin's uses, benefits, and potential side effects is not just an academic exercise. It's a practical guide for those who find themselves or their loved ones relying on this medication. The journey through the complexities of Ventolin is guided by the hope of demystifying its role in respiratory health management, providing clarity and insight for all who seek to understand this crucial medication. What is Ventolin used for? Ventolin, a name synonymous with relief for many battling respiratory conditions, primarily serves as a bronchodilator. This pivotal role it plays cannot be understated. By relaxing the muscles in the airways, it facilitates smoother airflow, providing much-needed relief from the symptoms of asthma and other similar conditions. Its use is a testament to the advances in medical science, offering a reprieve to those ensnared by the unpredictability of respiratory ailments. The scope of Ventolin's application extends beyond mere symptom management. It's a key player in the management of chronic obstructive pulmonary disease, COPD, including chronic bronchitis and emphysema, conditions that significantly impair the quality of life for those affected. The breath of fresh air that Ventolin provides is not just literal but symbolic, representing a step towards better health and increased activity levels for individuals with these conditions. Understanding the role of Ventolin necessitates a deep dive into the mechanics of respiratory distress and how this medication works to alleviate such distress. It's a window into the complexities of managing conditions that affect breathing, highlighting the critical nature of such medications in the broader context of respiratory health management. Common purposes of Ventolin. Ventolin is not a one-dimensional medication. Its uses span a range of respiratory conditions, making it a versatile tool in the respiratory health management arsenal. Primarily, it serves as a frontline defense against the episodes of wheezing and shortness of breath associated with asthma. Its rapid action in opening up the airways is a critical aspect of managing asthma attacks, providing swift relief and preventing the escalation of symptoms. Beyond asthma, Ventolin's role extends to exercise-induced bronchoconstriction, EIB, a condition that affects many athletes and individuals engaging in physical activity. The ability of Ventolin to prevent and treat this condition underscores its importance in enabling individuals to maintain an active lifestyle without the constraints imposed by respiratory conditions. The common thread in Ventolin's applications is its capacity to enhance the quality of life for those with respiratory conditions. Whether it's providing relief from the chronic symptoms of COPD or enabling an athlete to compete without fear of exercise-induced asthma, Ventolin stands as a testament to the progress in managing respiratory health challenges. Advantages of using Ventolin. The benefits of Ventolin extend far beyond its immediate relief of respiratory symptoms. Its rapid onset of action is a key advantage, offering swift relief when it's most needed. In the throes of an asthma attack or when faced with the sudden onset of respiratory distress, the quick relief provided by Ventolin can be life-changing, allowing individuals to regain control over their breathing and, by extension, their situation. Another significant advantage of Ventolin lies in its ease of use. Inhalers, the most common form of this medication, offer a direct and efficient method of delivering the medication to the lungs, where its action is most needed. This direct delivery system minimizes systemic side effects compared to other forms of medication administration, making Ventolin a preferred choice for many. Moreover, Ventolin's role in long-term management strategies for chronic respiratory conditions cannot be overlooked. By providing a means to manage symptoms effectively, it enables individuals to lead more active and fulfilling lives. The psychological and physical benefits of being able to participate in everyday activities without the constant fear of respiratory distress are immeasurable, highlighting the profound impact Ventolin can have on the lives of those it touches. Potential side effects of Ventolin. While Ventolin is a beacon of relief for many, it's important to acknowledge that no medication is without its potential drawbacks. The side effects associated with Ventolin, though generally mild and manageable, warrant consideration. Commonly reported side effects include tremors, headache, and an increased heart rate, symptoms that are typically transient and diminish with continued use. These side effects are a reminder of the importance of using Ventolin as directed by a healthcare professional, ensuring that the benefits outweigh any potential risks. In some instances, individuals may experience more significant side effects such as palpitations or an irregular heartbeat. Such occurrences, while rare, underscore the need for medical oversight in the management of respiratory conditions. It's a delicate balance, navigating the path to relief while minimizing the potential for adverse effects. The discussion of side effects is not meant to deter the use of Ventolin but rather to inform and prepare those who rely on this medication. Awareness and understanding of potential side effects are crucial components of responsible medication management, empowering individuals to make informed decisions about their health care. Dosage recommendations for Ventolin. Navigating the dosage landscape of Ventolin requires a tailored approach, one that considers the individual's specific needs and the severity of their condition. The standard dosage for adults and children over the age of 12 typically involves 2 inhalations every 4 to 6 hours, a regimen designed to provide relief while minimizing the risk of overuse. For those with exercise-induced bronchoconstriction, a similar dosage shortly before exercise can prevent the onset of symptoms, offering protection during physical activity. The pediatric population, particularly children under the age of 12, requires careful consideration when determining the appropriate dosage of Ventolin. A reduced dosage, often 1 inhalation every 4 to 6 hours, is generally recommended, tailored to the child's response and the severity of their condition. This careful calibration ensures the efficacy of the medication while safeguarding against potential side effects. Dosage adjustments may be necessary based on the individual's response to the medication and the evolving nature of their condition. Regular consultations with a healthcare professional are essential, ensuring that the Ventolin dosage remains optimal for the individual's needs. It's a dynamic process, one that emphasizes the importance of personalized care in the management of respiratory conditions. Risks associated with Ventolin usage. While Ventolin is a critical tool in managing respiratory conditions, its usage is not without risks. Over-reliance on Ventolin, particularly in the absence of a comprehensive asthma or COPD management plan, can lead to a worsening of symptoms. It's a stark reminder of the need for a balanced approach to respiratory health, one that includes regular monitoring and adherence to a prescribed treatment regimen. The potential for Ventolin to mask worsening symptoms is another risk that warrants attention. Relying solely on symptom relief without addressing the underlying causes of respiratory distress can lead to a dangerous escalation of the condition. This highlights the critical importance of regular medical evaluations, ensuring that Ventolin remains a part of a broader, more effective management strategy. Furthermore, the risk of interactions with other medications is a consideration for those using Ventolin. Informing healthcare providers of all medications being taken is crucial, allowing for the identification and management of potential interactions. It's a complex interplay, one that emphasizes the importance of comprehensive care in the management of respiratory conditions. Precautions when using Ventolin. The journey with Ventolin, while marked by the promise of relief, is one that necessitates caution. Recognizing the signs of overuse is paramount, as reliance on Ventolin to the exclusion of other management strategies can lead to detrimental outcomes. Symptoms such as an increase in the frequency of inhaler use or a decrease in the effectiveness of the medication signal the need for a reassessment of the management plan, highlighting the dynamic nature of respiratory condition management. Equally important is the need for regular maintenance of inhaler devices, ensuring their optimal performance. Proper technique in inhaler use is critical, maximizing the delivery of the medication to the lungs and enhancing its efficacy. Regular consultations with healthcare professionals provide an opportunity to review inhaler technique, ensuring that the full benefits of Ventolin are realized. The consideration of potential allergies to Ventolin or its components is also crucial. Individuals should inform their healthcare provider of any known allergies to ensure the safe use of this medication. It's a comprehensive approach to safety, one that underscores the importance of open communication and collaboration in the management of respiratory conditions. Alternatives to Ventolin. While Ventolin plays a pivotal role in the management of respiratory conditions, it is not the sole option available. The landscape of respiratory medication is diverse, offering alternatives that may be more suitable for certain individuals. Long-acting bronchodilators, inhaled corticosteroids, and combination inhalers represent a spectrum of options, each with its unique advantages and considerations. The choice of an alternative to Ventolin is guided by the specific needs of the individual and the nature of their respiratory condition. Inhaled corticosteroids, for example, may be more appropriate for individuals requiring long-term management of inflammation in addition to symptom relief. The decision is a nuanced one, requiring a thorough evaluation by a healthcare professional to determine the most effective and appropriate treatment plan. Exploring alternatives to Ventolin is not a journey to undertake alone. It's a collaborative process, one that involves detailed discussions with healthcare providers to assess the benefits and risks of different options. The goal is always clear: to find the most effective, safe, and suitable treatment for managing the respiratory condition at hand. Conclusion. Ventolin, with its ability to provide rapid relief from respiratory distress, stands as a cornerstone in the management of asthma and other respiratory conditions. Its significance is underscored by the relief it offers to those in the grip of an asthma attack or struggling with the chronic symptoms of COPD. Yet, as with any medication, the journey with Ventolin is one that requires careful navigation, balancing its benefits against potential risks and side effects. The exploration of Ventolin's uses, advantages, and considerations is more than an academic exercise. It's a practical guide for those touched by respiratory conditions. It's a narrative that emphasizes the importance of informed, cautious use, and the pursuit of a comprehensive management strategy that encompasses more than just symptom relief. As we conclude this journey through the landscape of Ventolin, the message is clear. Ventolin represents a vital tool in the respiratory health management arsenal, but it is not a panacea. The path to optimal respiratory health is multifaceted, requiring a balanced approach that includes Ventolin among other management strategies. It's a path marked by collaboration with healthcare professionals, adherence to prescribed treatment plans, and an unwavering commitment to pursuing the best possible outcomes for those affected by respiratory conditions. In the quest for breathing relief and the management of respiratory conditions, Ventolin plays a pivotal role. But it is the informed, cautious, and comprehensive approach to its use that ultimately defines the journey toward better respiratory health.